Hey everyone, got a little bill today from Scripps Medical Center, which is in San Diego. My wife was there a couple of months ago, and our son was a little bit sick, and truthfully, he was a little dehydrated, and because San Diego is not where we live, she basically had to go to the ER. Because I was a little worried about him. I wanted to make sure, he wasn't too dehydrated. So anyway, we got the bill today for this, and I'll just share with you what the total amount was. Obviously, there's going to be some adjustments, and I want to kind of walk through the scam of the U.S. healthcare system. So the total bill was just under $6,000. It was $5,900. I want to point out what was done during this ER visit. He had a very basic set of chemistry labs done, which demonstrated that indeed he was a little bit dehydrated. They put a little bit of IV fluid in him, somewhere between 250 and 500 cc. Yeah, and that's it. And then he went home. So let's see how that adds up to $6,000. There's a pharmacy charge for $20. I'm guessing that was the IV fluids. There was some other charge for $683, unspecified. This one's my favorite. Lab services, the basic metabolic panel, sodium, potassium, those things, $2,412. There was emergency services. I'm guessing that has to do with something to do in the emergency room. That was $2,752. Now, astonishingly, our insurance company, Aetna, decided that they would be willing to pay about 4,000 of those dollars, which left us with a $2,000 bill, which I suppose we have no choice but to pay. And obviously, we're fortunate enough that we can pay that. But I think what this illustrates is the leading cause of personal bankruptcy in the United States is what? Health insurance, or rather lack of insurance or underinsurance, and basically it's healthcare issues. And I will say this, I'm not one of those people who came to the United States from a country like Canada who thinks, healthcare is horrible here and I wish it was socialized like Canada. No, that's not the case at all. In fact, I think a single payer system has many problems. But I think this is the single greatest problem of the US healthcare system, which is that you have a completely artificial set of costs that are a part of everything. And this is why you see we pay 3 times per capita in healthcare what any other country pays in the developed world. And it's why, although it gets some attention, probably not enough attention, while there are lots of things that are fiscally irresponsible about the United States, there are probably none more than this. But this is a classic example of what it's looked like. And this isn't the first time I've received a bill and been very disappointed and frustrated and basically had no recourse but to pay it and to think to myself, well, what would I be doing if I couldn't afford that? I mean, what would I be doing if I couldn't afford to pay $2,000 for something that clearly wasn't worth $2,000? I mean, if anybody's paid attention to what $2,000 will buy in other countries for their health services, you start to realize that until we fix this problem of pent-up charges and nonsense that are understood that, oh, well, we're going to charge you $6,000, but you're really going to discount it because, you're going to pay this much and there's going to be a credit that goes this way. I mean, it's a total game. Anyway, I'm saying this not just to vent, though obviously you can tell I'm somewhat venting, but more just to say that, this is something that I wish more people would get irate about, because I don't think this system's going to change without a serious structural reform, which I've thought a lot about. And I won't deny that I don't have an obvious solution. I wish I could say it's just do this. It's not. There's a lot of things that would be required to fix this. Yes, a single payer system would fix this, but that would introduce a whole bunch of other problems. So the reality of it is, at the macro level, a solution is probably a single payer system that covers all basic needs, including emergency services, and then private insurance on top of that for folks who choose to have it, who can afford it, who want additional services that go beyond basic coverage. But again, I will reiterate that the leading cause of personal bankruptcy in the United States is medical expenses. And it's easy to understand why when you see these kind of nonsensical bills that truly make no sense at all. There's nothing about drawing a basic metabolic panel and giving IV fluids that warrants a $6,000 charge if you live on the planet Earth.